It's Tuesday, December 10th, and this is the Daily Medical News, where we bring you clinical medicine's top stories, plus an in-depth look at the day's biggest story. I'm Terry Rudd.
And I'm Nick Andrews. Today, a triple antibiotic combo shows promise in Crohn's disease.
More states are pushing plans to pay for telehealth care.
Bilateral mastectomy reduced second breast cancer risk, but not deaths.
And social anxiety is more likely in teens with predominantly inattentive ADHD and psychiatric comorbidities.
Plus, debate heats up over the merits of a strict glycemic control for older adults. And now, the top stories in clinical medicine.
An oral triple antibiotic combo pill may offer a promising new approach to treating Crohn's disease. The proprietary treatment is known for now as RHB-104, and it contains rifabutin, clarithromycin, and clofazimine. In the Phase 3 MAP-US trial, 331 patients with Crohn's disease were randomized to RHB-104 or placebo. Patients were allowed to continue treatment with corticosteroids, TNF inhibitors, and immune suppressives. Those on RHB-104 saw significantly greater rates of clinical remission and improvement in inflammation compared with placebo. By week 16, the clinical remission rates were 42% among RHB-104 patients and 29% among placebo patients. So, what explains the treatment effect? RHB-104 is effective against Mycobacterium avium paratuberculosis, or MAP, and the study's Baylor College of Medicine researchers note that MAP has been considered as a possible cause of Crohn's disease since the disease was described by Crohn in 1932. The investigators add that their findings provide further evidence backing an important role for MAP or similar microorganisms in the pathogenesis of Crohn's disease. The findings were presented at the annual meeting of the American College of Gastroenterology.
And more states are enacting laws that require private plans to cover telehealth services. But a new analysis finds fair payment remains a challenge for providers. In 2019, 42 states and the District of Columbia had commercial payer telehealth laws, according to a report by the law firm Foley and Lardner. In contrast, about 30 states had such laws back in 2015. Overall, the report's authors say the landscape for reimbursement of telehealth services by commercial payers has improved, but payment parity for telehealth services is still lacking in many states. Payment parity refers to insurers paying for telehealth services at the same or an equivalent rate as those delivered in person. In 2019, 16 states had laws that specifically addressed reimbursement of telehealth services, but only 10 offered true payment parity.
Compared with breast-conserving therapy, bilateral mastectomy significantly lowered the risk for a second contralateral breast cancer, but it didn't decrease the risk of death. That's according to a large retrospective study by Stanford University researchers. Their findings appear in the journal Cancer. The investigators analyzed data from more than 245,000 patients who underwent unilateral breast cancer and were followed for more than 6 years. 52% of patients underwent breast-conserving therapy, 37% underwent unilateral mastectomy, and nearly 8% had bilateral mastectomy. The absolute excess risk for second contralateral breast cancer was lowest in women with bilateral mastectomy, but the risk of death from breast cancer was similar for those who underwent either breast-conserving therapy or bilateral mastectomy. It was 20% higher among women who underwent unilateral mastectomy compared with breast-conserving therapy. Given that second breast cancers are rare, the researchers say reducing the risk should be weighed against the harms associated with bilateral mastectomy.
Are you treating an adolescent patient with inattentive ADHD and psychiatric comorbidities? Well, pay particular attention to their increased risk of social anxiety. Spanish researchers recruited 234 patients with ADHD with a mean age of 15 years. The investigators found that 50% of patients had a psychiatric comorbidity. Learning and communication disorders and anxiety disorders were the most common. They occurred in 20% and 19% of all patients, respectively. Patients with predominantly inattentive ADHD had significantly higher social anxiety scores compared with those with predominantly hyperactive impulsive ADHD. Comorbid anxiety disorder was associated with the worst social anxiety scores. Given the findings, the researchers say detecting and treating social anxiety in these patients could help clinicians with secondary prevention and future comorbidities. These data appear in the journal Annals de Pediatria.
Is strict glycemic control appropriate for older adults? That question was the subject of a debate between two experts at the 2019 Congress of the International Diabetes Federation. Current guidelines from the Endocrine Society on diabetes management in older adults call for shared decision-making and individualized approaches. Dr. Meta Munshi is director of the Joslin Geriatric Diabetes Program at Beth Israel Deaconess Medical Center in Boston. She says strict glycemic control in the elderly is meaningless. Why? First, the benefits of strict glycemic control in older adults aren't clear. And second, the risks are catastrophic and well documented. Dr. Munshi notes that a 2013 review of more than 2,400 diabetes-focused studies on clinicaltrials.gov showed just 0.6% included participants who were older than 65 years. And 31% of the trials specifically excluded that age group. Dr. Munshi explains that those at greater risk from the hypoglycemia associated with intensive glycemic control are people who are older and frail, have longer duration of diabetes, and are unable to safely follow complex regimens. But Dr. Ryo Suzuki argues that strict glycemic control isn't meaningless. Dr. Suzuki is a professor at Tokyo Medical University. He notes that the elderly population is very diverse, and hemoglobin A1C isn't a perfect marker of glycemic control. Plus, new glucose-lowering drug classes may have benefits beyond reduction of blood glucose levels. Instead, it's important to evaluate individual patients' health factors. Dr. Suzuki says those include hypoglycemia risk, disease duration, life expectancy, comorbidities, and established vascular complications. For a closer look at the pros and cons of strict glycemic control in the elderly, click the link in the podcast notes. And that's it for today's Daily Medical News. Remember, you can find the Daily Medical News on Apple Podcasts, Google Podcasts, Pandora, Spotify, or wherever you get your podcasts. For MD Edge, I'm Terry Rudd.
And I'm Nick Andrews. Thanks for listening to the Daily Medical News.